welcome to the Complete Health Podcast, the podcast that brings you a complete view of healthcare, exercise as medicine, and much more.
We're your hosts, Helen O'Leary and Reece, both physiotherapists at Complete Physio Pilates in London.
Welcome to episode 8, the second part in our chat where we're sitting down with Clare Pacey, a pelvic health specialist, to talk about everything to do with pregnancy.
We know that most people see pelvic health physio as all things to do with pregnancy and women. So in this episode with Clare, we delve deep into everything pregnancy-related conditions and discuss how you can stay active during pregnancy. Hello and welcome to episode 8 of the Complete Health Podcast. This is the second part of our chat with pelvic health physio, not going to call you women's health physio anymore, Clare Pacey, who works with us at Complete. Thank you for being with us again, Clare. I really enjoyed our first chat, so looking forward to getting all things pregnancy over these next couple of chats. I'm here, of course, with Helen O'Leary, my co-host as well.
Hey guys, nice to meet you, see you, hear you again.
Yeah, enjoyed the first part?
I did, very much.
Enjoying those pastries in front of you there?
Yeah, there's 2 halves left and they are going to go probably
slowly
by the end of this one.
I must admit I am eyeing them off also. Alright, so for those who haven't listened yet, our first episode with Clare, we went through what is a pelvic health / women's health physio and went through some common musculoskeletal issues that can be attributed to some pelvic health issues, and Clare rattled off a list of about 100 different conditions that she sees, which was quite eye-opening to have them all listed in one go there. Our second part of our chat with Clare is going to focus on pregnancy. So working in the clinic with Clare a couple of days a week, I see lots of baby bumps wander in and out of her room, and I always wonder what she's doing with the women in there and what pregnancy physio during pregnancy looks like. So this will be a really interesting one, I think. So thank you.
Brilliant.
Cool. So, Helen, kick off. Let's go.
Yeah, so like Reece says, he sees a lot of people kind of with baby bumps walking into your room. So why are they coming to see you?
Yeah, so I see a lot of women in pregnancy, and it's a lovely client group actually, because it's very happy and it's all lovely, and they're often coming in with really bad pains, but they're quite happy still because they're pregnant and it's great. So yes, I'd say very commonly there's obviously a huge range of different things, but the most common things they tend to come and see physio for in pregnancy is either pelvic girdle pain or back pain. So pelvic girdle pain affects 20% of women in pregnancy, so 1 in 5. So
just to clarify, when you say pelvic girdle pain, where are we talking? So
any pain around the pelvis, so that might be on the pubic bone into the groin, it could be on both sides or just one side, and then kind of around the back. So you could have just pain at the front or just pain at the back, or you could have it the whole way around, so kind of around the sacroiliac joint area, so that kind of whole region.
So anywhere that your underwear would cover.
It's quite a classic picture actually. So it tends to be pain with movement. So especially things where they're parting their legs, so turning over in bed, getting in and out of a car, standing on one leg to put your trousers on, those sorts of things. And then when you're not moving, it feels better. And it's quite a frustrating pain because, you know, when you're pregnant, you're told to keep walking and be active and you want to be fit. And the thing with pelvic girdle pain is it's a case of pacing yourself and not doing nothing. And I keep every patient I have with pelvic girdle pain exercising to the end. That's, exercise is a magic bullet and that's really important. But often with modifications and kind of, finding the right balance for them. What's really interesting about pelvic girdle pain is it's often women are told that it's because they're unstable. And this is my huge pet hate. And I think it's actually quite harmful to tell someone that they're unstable, especially when they're not, Yeah. I don't know. I remember working on intensive care as a junior physio and patients coming in having been in road traffic accidents and they've literally broken every bone in their body except their pelvis. The pelvis is so robust and so strong, and if you're telling someone that the reason they've got pelvic girdle pain is because of relaxin, do you know about relaxin? It's the pregnancy hormone that makes everything a bit more stretchy. And so people are told, and to be honest, I was taught this, but things change. And people are told that, it's because of the relaxin, everything's moving around and it's less stable, and that's why you're getting pain. Now, if you're told that, what is that going to make you feel?
It's going to make you absolutely
terrified of moving, and that's going to make your pain worse, and then it feeds into this cycle that can develop into kind of a chronic pain picture as well. So it changes your whole wiring.
Happening?
So we don't know the cause. And what's interesting is that all women have relaxin and only 20% get this pain.
Yeah.
We do know, and this is not something in the research, this is what I find in practice, is that if someone comes in and sees me early on in pregnancy with pelvic girdle pain, usually I can very quickly get on top of it and it goes for the rest of their pregnancy. And then the patients that will come in kind of 35 weeks pregnant, last bit, just developed it, I find I can improve it, and I like to give them the education so they don't feel fearful and they have a good understanding of what it is, because then it will go after. But it doesn't tend to fully go as a rule. Not always the case, but it's more due to a sensitized system. And a bit in the first episode, I spoke about that scary movie research where the muscles become hype. I think there is an element of just the whole system is quite sensitized, and we don't know why some women get it more than others. We don't know. There's no correlation
to the amount of exercise you do.
No,
or
nothing.
Don't do.
Athletes get it. Personal trainers get it. People that don't do any exercise can get it. There is a correlation that if you had it with one pregnancy, you may be more likely for your subsequent pregnancies, but it might not happen. But more, it's important that women know that it's just sensitized and not damaged. It's not
like your pelvis is literally stretching apart.
No, everything's fine. You're robust. You're strong.
I mean, you're about to have a small human coming through your pelvis. So if it's apart, it's not apart. Is what I'm trying to say.
Exactly.
It's very strong. It's a great
It's
structure.
very robust, and so you must know that and keep exercising. And we are going to be looking at modifying your activities. So again, not giving people too many rules, but if you're sitting with your legs crossed and you're standing on one leg to put your trousers on, those things aggravate it a bit. So it's not going to damage it. So if you've got to do that, then it's fine. But if you keep doing it, it might aggravate it. Yeah. So, when you're sitting, be a bit more even. When you're standing, be a bit more even through your feet. When you're turning in bed, keep your knees closer together. Sit down to put your trousers on. So it's a bit of modifying things. But I don't know, I had a personal trainer I saw yesterday with pelvic girdle pain, and she's doing all her Zoom consults, and she's like, I need to be doing my HIIT classes because I'm doing it for, it's how I make a living. So I'm like, fine, of course that's fine. Do your HIIT class, but you just need to look at what you're doing the day before, because she's doing 2 of those HIIT classes a week, and the rest of the time she's doing other classes. You just need to look at, what you're doing before, what you're doing after, and just planning it a bit. You're not doing yourself damage. You're just going to irritate it a bit. So it's a bit boring. But if it is just a case of, pacing, modify the activities, keep exercising. And sometimes people need a bit of support with that. But, if you're seeing a trainer or you're in a class, they're brilliant at exercise regressions and modifications. So... and it depends how it feels. So there's no kind of rule of you mustn't do this or you mustn't do that. It depends on how it feels. And if something's aggravating, like if a deep sumo squat is aggravating you, come in smaller. You can always find another way of strengthening.
And how about you see a lot of people that start wearing these SIJ belts, so these belts that wrap quite low around your pelvis and lower back, and they use those when they exercise as well. So how about that sort of stuff?
Yeah, again, it depends. So try it. So I tend to get people to do like a scarf test. So I'll get them to put, because they can be quite expensive. They're not loads, but they're probably between £50. Yeah. And for some people it can make it worse. So for some people they have a lot of swelling. So some people find that actually putting a belt on compresses everything and just makes it more uncomfortable. So again, there's no evidence really either way. It depends. So for some people they can be really helpful and it makes them feel good. So do the scarf test, put a scarf around the pelvis, kind of put a bit of a pressure on. Does that feel nice? If it does, then it's a good sign that it might help you.
I remember that one, scarf test.
Have you patented that? The Pacey scarf test.
And then I really always look at Sleep, it's being a bit more holistic. How are they sleeping? If we haven't slept well, our pain's worse, and our system's more sensitized. What's going on with your bowels? I ask everyone about their bowels. If you come and see me, I want to know how often you poo, what your poo looks like, how easy it is to pass. I just want all the details. So you have to be open to give that. But if you are, it's interesting. Like, constipation is one of the biggest causes. GI problems are the main cause of back pain. Really, and I think often we don't think to ask about it. And same with the pelvis. So in pregnancy, constipation is more common because of the progesterone. So you have progesterone in your system for the pregnancy, and it's the job of progesterone to relax smooth muscle. So in your gut, everything's a bit more slow to pass through the system because the muscles aren't contracting to push things through.
So your gut's made of soft tissue. It
has smooth muscle, and that muscle's relaxed, so the stool takes longer to pass through, so more water's absorbed. So more water's absorbed, and so it becomes drier. So some people who have never experienced constipation in their lives might get a bout of it. It's interesting though, because you'd think someone who has constipation would then get really bad in pregnancy, but the opposite seems to happen for some unknown reason, and they're fine in pregnancy. I think sometimes the body just likes something a bit different, just rewires it, and things. So again, I'll always ask about bowels, and if you are constipated and your stool's quite hard and you're not going regularly, that's actually one of the first things I will address. So looking at diet and making sure you're getting your 30 grams of fibre a day, which is actually harder than you'd think to get 30 grams of fibre a day. And bearing in mind that's kind of guidance, which should be easily achieved, a bit like 5 fruit and veg. We know that actually 10 fruit and veg is what we want to be doing. So we aim low, but actually getting 30 grams of fibre, if you're not having any grains, is difficult. So flaxseed is always something I recommend. Putting a couple of spoonfuls of flaxseed into your porridge or something like that can help. But looking at fibre, looking at diet, and how you go to the loo, but that's probably separate. But yeah, that's sort of how I'd manage it. And I do manual therapy, of course, and acupuncture and hands-on treatment. I'm very hands-on in a how do I describe it? I'm hands-on, but I'm also very keen on exercise and the whole system, really.
So you kind of touched on back pain. And one of the things you hear all the time for pregnant women is that your pelvis is going into an anterior tilt, so you've got a much bigger curve in your lower back, and that's why you're getting back pain.
No, you don't.
Do you want to talk us through that one?
Yes. So very few people are anteriorly tilted. Very few. I don't see it very often. I don't know about you two. I don't see it very often.
I think it's like anything. So we deal with a lot of lower back problems and things, and when you have a scan you can see their pelvic instance, i.e. how much the pelvis is tipped naturally, so where the sort of front and back is no longer kind of quote level, and that can be kind of a normal thing that you're sort of born with,
so in pregnancy your center of gravity will change because you've got a bump at the front. So if you don't, and that's interesting, often balance is something I really work on postpartum, but we'll come on to that because your balance gets really affected because your centre of gravity is changing. So because you've got this kind of bump at the front of you, if you don't change your posture a little bit, you'd almost fall and topple forwards. So what people do when they're pregnant is lean back a little bit. And so a lot of people will see that leaning back, so the rib cage is stacked a bit back on the pelvis. They will say, that's because you're anteriorly tilted, because they'll see this increase in the lumbar lordosis. And so then they'll say to them, okay, so what I want you to do is tuck your tailbone under. But that's not at all what's going on. And actually tucking your tailbone under is the opposite of what we want. I want your glutes untucked and kicking in, and your glutes and your pelvic floor are best friends, and we want your glutes to be strong. And tucking under also causes you to grip your tummy, which stops your diaphragm working. And again, talking about bowels, diaphragmatic movement, we know from the research, massages the colon. So it's all linked. So absolutely, it's more that you've leant back. Not that you're it's extension. So that is something that is a common thing I see, and is often I say to people, think about universal athletic pose. If you're about to catch a ball, you do not stand in that leant back position. You kind of lean in because you're more ready, your deep system, your core's engaged, your glutes are kicked in, everything can connect. So yes, if you are pregnant and you see yourself and you feel very comfortable in that leant back, stacked back position, if it's comfortable, it means you do it a lot, basically, because everything we do all the time becomes a habit. And so if it feels comfortable, it's not necessarily, well, nothing's right or wrong, but it's not necessarily the most optimal way of doing something. It just means you do it a lot. So I say to people, just lean in a bit or untuck your bottom, actually. And that brings you into a back upright rather than tucking under.
So just pretend you're about to catch a ball all the time.
Basically, yes. Be ready.
For things to be thrown.
And it's really common in the postpartum period. I know we're talking about pregnancy, but again, if you've spent pregnancy leaning back a bit and you've got used to that position, so your wiring is now, it's wired in, it's automatic, and then you have a new baby that you're lifting. I'll see women 30 years down the line, 30 years postpartum, and they're still standing as if they're pregnant. And so, we know that rehab in physio is all about changing things and rehab. None of it's forever. But if you don't change those things and rewire in a new way of moving, that old way just sticks. And you do develop, not ideal strategies in pregnancy because you have to compensate. And there's nothing you can do about that. It's just making sure you are aware of it, check in on it, and focus on it after for a couple of weeks of thinking about it.
And again, that's where postpartum contact with a pelvic health physio is so important. And doesn't get recommended enough to women who are pregnant because there's so many things you can nip in the bud in that first 6 weeks.
It's not a lot. Exactly. It's just getting on top of those strategies. And in pregnancy, if I am seeing someone for pelvic girdle pain or back pain or whatever it is, I do always, if they consent to it, do an internal examination just to get a really good baseline of their pelvic floor, take some measurements of the structure, check for prolapse, check their pelvic floor strength and endurance and coordination. And so you've got a good baseline measure of where you're at before.
Because obviously a lot of women have really normal pain-free pregnancies, which I think is really important to stress.
Absolutely, yes.
We tend to see people with injuries because that's what we do.
Yeah,
actually
have a warped view.
Everyone
has
women.
That's all we see.
But women, we are built to be able to
Absolutely.
do this amazing thing. So a lot of women are completely fine during their pregnancies and everything else. So would you recommend that if someone is fit and active, that they come and see you anyway, even if they don't have problems? Or is it just no, crack on, like you're doing really well?
I would. I mean, I get all my girlfriends. I assess them all if they'll let me. I'm like, let's get a baseline of where you're at now. Let's get an idea of what you're doing. So I think if you're keen on preventative care and you're quite holistic and you want to, come and see us. I love it when someone comes in and just says, actually, everything's fine. I have no idea. No one's ever assessed me and I want to check. I love that. And, it might just be a one-off session. And you can still give guidance on, preparing for birth and the initial postpartum. And there's always some things you can do. But if, you're feeling really good and you don't want to be spending the money on it, then crack on too, it's fine. But obviously I think everyone should come and see me.
Is there research around what percentage of women get back pain and pelvic girdle pain during pregnancy?
Yeah, so it's 20% pelvic girdle pain and 50% back pain.
Okay. So it's normal.
Exactly.
Yeah,
it happens a lot. Back pain is different to pelvic girdle pain, and like I said, with pelvic girdle pain, it's the system's sensitized, so it's a bit of the annoying modifying activities and pacing yourself. Whereas back pain, it's like, get moving, I always tell them all to walk with swagger because you become quite stiff and rigid because of the bump. So everything, you end up a bit waddly. And so I really get people to just get a bit of rotation through the middle, and refer them to Pilates to get moving and keep strong. And for me, in pregnancy, it's all about motherhood is all about lifting. So we need to be preparing people in pregnancy for that, because it's heavy lifting, like pretty soon after having a baby. Exactly. Pretty soon you're lifting 15 kg.
Still wants to be picked up.
Exactly. So you need to be strong, and we need to be preparing people to meet that demand.
So then let's talk about exercise in pregnancy. So lots of people go, well, when should I stop running? When should I stop weightlifting? When should I stop doing this? And what should I do? Some people who have never exercised before suddenly think they should exercise. So what's the, should you exercise during pregnancy? And kind of when should you stop, change, develop anything, if you should?
So absolutely. There was thoughts a long time ago where it was like you shouldn't start something new. And that's just not the case. Everyone should be exercising in pregnancy. The World Health Organization recommend 150 minutes of moderate intensity exercise a week, plus 2 sessions of strength training.
And this is sort of back to, so the Canadian guidelines, national guidelines now are sort of saying that and are
for everyone
prescribing exercise to pregnant women for that minimum of 150 minutes of a variety of
what a revelation. Exercise.
I know. It's a magic bullet after all. I mean, it's not rocket science, is it? But so that's why even if someone's got pelvic girdle pain or something, it's the goal for me is always to find a way for them to be exercising pain-free. But so everyone should be. You can start something new. With regards to running and CrossFit and lifting and things, running, you can run. So go by how you feel. I've actually never had to say to someone stop running. People usually get to a point in pregnancy. I don't really hear many people run to the very end, because most people just get to a point where it just doesn't feel quite right, and they will just stop themselves. So it's not something I have to, but there's no reason why you can't. There's no literature that says you can't run throughout. So people just have to listen to their bodies, and I'd say most people get to the point where they just think, you know what, it just doesn't feel quite right, I'm going to change to swimming or something. Exactly. So you might need to modify, you might need to regress, you might need to adapt it, and that's where you might want some help from a physio. And the same with CrossFit. I think you're already carrying a huge load, and so I would work within a range that, and again, this advice will change because there's so much we don't know because the research hasn't been done. But we know there's a huge load already on the pelvic floor, and in pregnancy I have had people that do CrossFit come in, I've got some weights into my clinic room, and I've got them to lift weights whilst I've got my finger in their vagina, and I'm able to check if they're bearing down. So, and if they're not bearing down, so that's fine. But I tend to say, work within a range, work at around 70% of your max, where you're still going to get strength gains, but you're not going to cause downward pressure. If someone's lifting and bracing to do it, or breath holding to do it, we know that causes downward pressure. And do you want that when you already have a weight of a baby? Like, it's not going to be great it's going to weaken the pelvic floor. But if they're able to manage their pressures, they're able to breathe whilst they're lifting, and they're not bearing down, then, that's good. Like I said, motherhood's about lifting. We need you to be strong for that.
Sort of, why did then the WHO or the World Health Organization and kind of Canada, why are they saying exercise is key now? There's obviously lots of health benefits and stuff for it, but why particularly in pregnancy? I think they've said that for a long time, actually. I think it's that advice has been there for a long time to exercise in pregnancy, because of so many, there's so many benefits of exercise. And I think they realized that a lot of people were stopping because of the scaremongering. So, and I also think in the first trimester you feel rotten. Not everyone, but a lot of people feel sick and tired. And so you stop exercising because you feel nauseous and tired, which is absolutely fair enough. And then you get out of the habit. And then by the second trimester, women are a bit like, I don't really know what I can do and what I can't do. So then it just never really gets going. And then by the third trimester, you're quite heavy and uncomfortable. And so it can never start. So so I think it's just highlighting the, keep it up. I think the only things you wouldn't be doing are, there are certain times when women are told not to exercise, but if that's you will know about it because your doctor will be saying to you,
it's usually things related to the cervix, but they will be saying to you, there are some women that are put on bed rest because they can't be, they need to be on bed rest. Obviously, they shouldn't be exercising, but you'll be told that. Otherwise, it's really, we tend to say avoid contact sports. Our body is, because of obvious reasons, but to be honest, it would probably, you have women in late stage of pregnancies in car accidents and they're okay. And actually, we are quite robust, but don't put yourself, don't risk that. Don't play hockey, of course. And, no scuba diving for pressure reasons and no water skiing because, the water can shoot up the vaginal canal and things like that. But otherwise, exercise is good and sport is good. And if you shouldn't be exercising, your doctor will tell you so. And if you need help with modifications, then seek some professional advice. A lot of people with CrossFit and things using a bar tend to stop use of bar because you almost have to move it around the bump, which is quite tricky. And they don't want to you just kind of retrain a new way and then you've got to untrain it again. So I think it's just sometimes easier just to change and modify. And towards the end, you're going to regress things down, but you listen to your body. And if you're doing an exercise and you're leaking or you're feeling loads of heaviness or pressure going down, or you're getting pain, then it's a sign that you're not managing that demand and you need to change something. So regress it.
So that's a really good marker for you as a patient, but also you as a clinician. If you're giving people anything to do with that, or they're coming in and saying that kind of thing.
Yeah, a trainer or a physio watching a lady who's pregnant exercise and she's having to hold her breath to do something or brace or grip. It's too hard for her. So, and I would be asking those questions. If you're training someone in pregnancy, you need to be asking them, did you feel any downward pressure? Did you have any leakage? If you have these symptoms, you need to tell me because it means it's too hard and we need to modify.
And if you're a client listening to this and you think, oh yeah, I do that when I'm doing my free Instagram classes or my online ebook or anything like that, then you've gone too far.
Yeah, exactly.
So I just wanted to touch on quickly during pregnancy, we see pregnancy massage advertised a lot and things like that. How beneficial is it? Do you recommend it?
I think it's each to their own. I think some people really enjoy having a massage. So
nice to
have a massage. Some people don't like it. It's absolutely fine to have a massage in pregnancy. I think it's an insurance thing. So a lot of massage therapists won't offer pregnancy massage, and that's not because it's contraindicated in some way. It's just because of an insurance covering perspective. But absolutely have a why not,
crack on.
For those qualified professionals, they can get these lovely pillows which effectively means you can still lie on your tummy.
They're lovely,
which means and we actually have some of those.
We have one.
We have one of those. So Tor
we have amazing
Complete does pregnancy massage, and you can lie on your tummy, which obviously is an amazing thing if you want to lie on your tummy when you're pregnant.
To be honest, that in itself is quite nice. Just lying on your front
and having a massage is probably quite common as well.
Beautiful. All right, so just wrapping up episode 2 with Claire, which is we've titled the pregnancy edition. So I think the big take homes for me out of that was exercise is fine during pregnancy. In fact, it's encouraged. If you're not sure or if you want some guidance, seek out the advice of someone like Claire, because there's modifications and things that can be done. Because we don't want you not exercising for 9 months and then obviously having to lift and bend and do all these things. It's really important to prevent that from happening before it comes along.
And I suppose the last thing to say is train, if you are training in pregnancy, practice lifts with twists, practice lifting with a bent back, because you're going to have to bend your back and lift to get your baby out of your cot. You're going to have to twist and lift to get your car seat out of the car. And so I think when people have injuries and difficulties with these things afterwards, it's often just because they're not trained for it, not because it's bad for you to do that.
Body hasn't been exposed to it.
And actually there is research that's come out about if you have a flex, so if your back is bent when you are doing a deadlift or a squat or anything like that, does it cause significant pressure on your discs and stuff? And the answer that they found was no.
Exactly.
So if you train that at lower weight and picking weight up from the floor, you are going to be strong enough to do what you need to do.
Perfect. All right, Claire, if people want to book in with you or just want to get in touch for some advice, what's your email address?
So my email is Clare, Clare, @rephysio.com. And I'm on Instagram as re.physio.
Excellent.
Brilliant. Thank
All right,
you.
that wraps up episode 12. Edition number 2, Claire. Yep, which is overall episode number 8 for us. And we'll be back soon with edition 3 with Claire, which is the birthing edition. That concludes episode 8 of the Complete Health Podcast. For any further information or queries, please feel free to email into us at either Reece at complete-physio.co.uk or Helen at complete-pilates.co.uk. We're also on the socials at Instagram under the handle at Complete Health Podcast.
And if you haven't already, please do go back and take a look at our previous episodes with Claire, where we look at exactly what a pelvic health physio is. Keep an eye out in the coming weeks for our next chat with Claire, where we're going to talk about everything to do with birth and the choices that you have. For another week,
stay healthy and goodbye.